piriformis. Oh, that's why I mentioned that before. Okay, this is very famous actually. All right, the proximal attachment. Look at that, nice, huh? Very beautiful. Anterior surface of the sacrum and the sacrotuberous ligament. All right, this is pretty much they cover that area, hold that. Distal attachment will be superior border, greater trochanter of the femur. Now, again, the slightly in the superior, okay? Slightly in the superior. Okay, over the great trochanter of the femur, all right? Now, main action. Since they are attached from posterior. Therefore, they're going to do what? External rotation, right? So lateral rotation or external rotation also help to extend the thigh, and the abduct flex the thigh and steady the femoral head in the acetabular. So if you look at this muscle, they come over here, all right? External rotation, they're going to extend. If you flex the thigh, they're going to what? Abduct the hip, because this direction, right? Up, oh, nice, okay, oh, nice. So, external rotation, extension, abduct, flex the thigh, because that's much easier. Now, how you stretch the piriform? Bring it up towards the opposite shoulder, and you can nicely stretch them, all right? Nicely stretch that. Innervation. This nerve innervation is piriformis nerve, branches of the ventral rami of the S1, S2. Arterial supply, superior and the inferior gluteal and the internal pudendal artery. Okay, arteries. Now, as I mentioned, anything from piriformis, okay, superior to the piriform will be what? Gluteal, superior gluteal something. Inferior to the piriform will be inferior gluteal something. Okay, superior gluteal nerve, inferior gluteal nerve. Basically, the name tells you they are inferior to the piriformis or superior to the piriformis. All right. Now, one thing I want to mention that if sometimes you have piriformis syndrome, the piriformis is getting so tight they're going to compress your sciatic nerve, and we know the sciatic nerve acts as what? It's two, right? We have a tibial nerve, we have a common fibular nerve. Now, if the piriformis syndrome, when it's getting so tight, what they compress first? What they compress first, if you see, they can compress the common fibular nerve. Okay, so piriformis syndrome usually, or let's say piriformis is getting enlarged, hypertrophy. This guy is, or ride bike and mountain climbing, the piriform is getting so enlarged, or could be piriformis so tight, then they compress the sciatic nerve. Okay, so it says when they compress sciatic nerve, you think about no, they compress common fibular nerve first. Therefore, the symptom is what? It's more go to the common fibular nerve. Okay, common fibular nerve, which is always go to the leg. You're gonna have a lateral compartment, anterior compartment. Okay, not too much symptom of the tibia, but in the early stage, you want to talk about it's more like involving the common fibular nerve. Now you kind of think about. That's piriform. And also piriform sometimes have a problem is the sciatic nerve maybe go through the piriform. That's hurt. Or sometimes common fibular nerves go up to the piriformis. That's a cause of pain. All right? So be aware of the variation sometimes. The piriformis muscle is very, very interesting muscle. Okay, involving a lot of clinical, manifestations. So be closely watch that. All right?